Hello friends, let us now learn some important points about pituitary adenoma. So, the main origin of pituitary adenoma is anterior pituitary. So, pituitary adenoma is the most common cause of hyperpituitarism, right? So, this pituitary adenoma can be of two types. One, we have functional or secreting pituitary adenoma, whereas second is non-functional pituitary adenoma. In functional pituitary adenoma, it will secrete the hormones, and as a result, because of this hormone secretion, you will see that the presentation of this functional pituitary adenoma is early, whereas in non-functional or non-secretory pituitary adenoma, it has delayed presentation. Sometimes it might be presented with bitemporal hemianopia directly due to the compression of optic nerve by the pituitary adenoma tumor. Right? Next. Now, the pituitary adenoma, there are two things. One, we have pituitary adenoma, and we also have pituitary hyperplasia. Right? So, this pituitary adenoma and pituitary hyperplasia, these both are actually separated by a stain called as reticulin stain. Reticulin stain will separate this pituitary adenoma with pituitary hyperplasia. So, if you see the clinical features include it is seen in third or fourth decade, and here it is common in males is equal to females. The most common type of pituitary adenoma, if you see, is prolactinoma is the most common type of pituitary adenoma, where you will see presence of amenorrhea and also presence of galactorrhea is seen as the clinical features in pituitary adenoma, which is producing prolactin. Investigation of choice is MRI, and we should also do the endocrinological profile should be done. Endocrinological profile should be done, and formal visual field testing should also be done in the patients. Right? So, if we see the treatment is first and foremost we do bromocriptine is the dopamine agonist which is given to treat the prolactinoma, and this bromocriptine will activate dopamine, which will inhibit the secretion of prolactin. So as a result, it will shrink the prolactin by 6 to 8 weeks. And the growth hormone secreting tumors, and this prolactinoma also this bromocriptine also shrinks the growth hormone secreting tumors by less than 20% of patients. In less than 20% of patients, it also shrinks growth hormone secreting tumors. Then mainly for growth hormone secreting tumors, we can use, actually we generally do not use this bromocriptine, I'm really sorry. Okay, actually we generally use the drug octreotide to shrink the bromocriptine secreting tumors, growth hormone secreting tumors. For shrinking the growth hormone secreting tumors, we can use this octreotide is used for shrinking the bromocriptine for shrinking the growth hormone secreting tumors. So for this octreotide will shrink growth hormone secreting tumors. Remember this, I'm really sorry, I got very confused at this point of time here in this point. Okay, so there are two things. One, bromocriptine bromocriptine will mainly shrink the prolactin secreting tumors, whereas this drug octreotide will shrink the growth hormone secreting tumors. Right? Next, if we see the indications for surgery, indications of surgery for in pituitary tumors include if the tumors are growth hormone secreting tumors, or if there is primary Cushing's disease seen in these patients, or if there is adenoma which is causing visual deterioration, if the adenoma is causing visual deterioration, or if it is a non-prolactin secreting microadenoma which is resulting in formation of symptoms. So in all these cases you will have to do surgery. Surgery, if you see, surgical approach can be sublabial approach, or we can have intranasal approach, or we can have transpenoidal approach. So with all these approaches, either through intralabial or transnasal or transpenoidal, we will have to remove the pituitary adenoma surgically. Okay, then we also have radiosurgery. There is one more thing which is called as radiosurgery. This radiosurgery is used as the primary therapy. It can be used as primary therapy, or it can be used as the adjuvant therapy also after total resection. And third, it can be used for recurrent diseases. You can use this radiosurgery for three things. It can be used for recurrent diseases, for primary therapy, and for adjuvant therapy. So this is about the pituitary adenoma, right? Thank you for watching.